Hi, Dr. Derek Rogalski here again, answering common patient questions. So a really common question that we get, and I think people often come at this from some personal experience. They have a coworker, a family friend, somebody who's had bariatric surgery and has had weight regain. So the question is, will I regain weight after surgery? How durable is this treatment? So the answer is probably twofold. One, a little bit of weight regain is normal. So if you look at a graph of weight loss after bariatric surgery, people go from a high weight to a low weight. And usually not an unhealthy low weight, but to their lowest point, usually at about 12 to 18 months after surgery. Then almost everybody, regardless of what they do, regardless of how much they exercise or control their diet, gains a little bit of weight back, usually about 5% of their body weight, sometimes as much as 10. That's a natural part of your body adjusting to having bariatric surgery. The lowest weight you achieve after bariatric surgery is usually not the weight that you will maintain for your life. And that's just because your body adapts, and we want your body to adapt, because part of that adaptation is also absorbing vitamins and minerals better, just getting used to having this new anatomy. Most people will maintain that slightly above their lowest weight for the rest of their life, and will be significantly less, will weigh significantly less and still have the resolution of those obesity related conditions like diabetes, sleep apnea, fatty liver disease, and we'll realize the benefits of reduced risk of cancer, reduced risk of sudden cardiac death. All of those things will be maintained for life. Now, there is a number of patients who regain an unhealthy amount of weight. What are those patients doing differently, or what's wrong with their treatment? So two things. One, many patients who have sleeve gastrectomies at other places are not getting an adequate or appropriate operation. Many times people who perform bariatric surgery, whether for profit or are not totally trained in it, or whatever their way of approaching it is, they're not getting enough of the fundus of the stomach out. So the upper part of the stomach, called the fundus, and the shape of a sleeve gastrectomy matters a lot. So if you look at the studies, patients with a sleeve gastrectomy are more likely to regain weight back than patients with either a duodenal switch or a gastric bypass. Part of that has to do with there's not a great standard way that surgeons are making sleeves, and some surgeons don't make a great sleeve. At Bay Bariatrics, we take a lot of pride in doing it right the first time. The next piece of it is that people's gut hormones change, and some people have really resistant obesity that starts to come back, particularly for people who make food and lifestyle choices where instead of shifting from a highly processed diet with significant carbohydrates to a diet that's rich in protein, healthy fat, and minimizes carbohydrates, they eat their same diet just in much lower amounts. Over time, the body can adapt to that, and obesity can recur. The good news for those patients is that many of the treatments of obesity that didn't work before work much better after surgery. So a patient who's gaining weight after bariatric surgery at an unhealthy level, if they dive down deep into what they're eating, when and what, and how they're getting their calories, many times they can reverse those trends because they have the advantage of the surgical tool to help them keep that weight off. Also, revision surgeries, changing a sleeve to a gastric bypass or duodenal switch, is super effective. And we're blessed to live in a time where there are now newer medications called GLP-1 agonists. You may have seen commercials for Ozempic or semaglutide, seen it in the news. Those medications, in addition to surgery, can make a huge impact in patients' weight. So a small percentage of patients will regain an unhealthy amount of weight after surgery. Everybody gains a little bit off of their lowest weight. But as you've all experienced, Obesity is a chronic condition that needs chronic lifelong intervention. Surgery is one big tool that you can invest in that can make a huge difference for the rest of your life and help control this disease, which is based in hormones and what we eat and how our bodies interact with that. We love your questions. Please keep sending them. And thank you for tuning in.